Chapter 21 The Cardiovascular System, Blood Vessels and Hemodynamics. Structure and function of blood vessels. Hemodynamics. Forces involved in circulating blood. Major circulatory routes. Anatomy of blood vessels. Closed system of tubes that carries blood. Arteries carry blood from heart to tissues. Elastic arteries. Muscular arteries. Arterioles. Capillaries are thin enough to allow exchange. Venules merge to form veins that bring blood back to the heart. Arteries tunica interna, intima, tunica media, tunica externa. Simple squamous epithelium known as endothelium. Basement membrane. Internal elastic lamina. Tunica media. Circular smooth muscle and elastic fibers. Tunica externa. Elastic and collagen fibers. Sympathetic innervation. Vascular smooth muscle is innervated by sympathetic nervous system. Increase in stimulation causes muscle contraction or vasoconstriction. Decreases diameter of vessel. Injury to artery or arteriole causes muscle contraction, reducing blood loss, vasospasm. Decrease in stimulation or presence of certain chemicals causes vasodilation. Increases diameter of vessel. Nitric oxide, K+, H+, and lactic acid cause vasodilation. Elastic arteries. Largest diameter arteries have lot of elastic fibers in tunica media. Help propel blood onward despite ventricular relaxation, stretch and recoil, pressure reservoir. Muscular arteries. Medium-sized arteries with more muscle than elastic fibers in tunica media. Capable of greater vasoconstriction and vasodilation to adjust rate of flow. Walls are relatively thick. Called distributing arteries because they direct blood flow. Arterioles, small arteries delivering blood to capillaries. Tunica media containing few layers of muscle. Metarterioles form branches into capillary bed. To bypass capillary bed, precapillary sphincters close and blood flows out of bed in thoroughfare channel. Vasomotion is intermittent contraction and relaxation of sphincters that allow filling of capillary bed 5 to 10 times/minute. Capillaries form microcirculation. Microscopic vessels that connect arterioles to venules. Found near every cell in the body but more extensive in highly active tissue, muscles, liver, kidneys and brain. Entire capillary bed fills with blood when tissue is active. Lacking in epithelia, cornea and lens of eye and cartilage. Function is exchange of nutrients and wastes between blood and tissue fluid. Structure is single layer of simple squamous epithelium and its basement membrane. Venules, small veins collecting blood from capillaries. Tunica media contains only a few smooth muscle cells and scattered fibroblasts. Very porous endothelium allows for escape of many phagocytic white blood cells. Venules that approach size of veins more closely resemble structure of vein. Veins proportionally thinner walls than same diameter artery. Tunica media less muscle. Lack external and internal elastic lamina. Still adaptable to variations in volume and pressure. Valves are thin folds of tunica interna designed to prevent backflow. Venous sinus has no muscle at all. Coronary sinus or dural venous sinuses, varicose veins, twisted, dilated superficial veins. Caused by leaky venous valves. Congenital or mechanically stressed from prolonged standing or pregnancy. Allow backflow and pooling of blood. Extra pressure forces fluids into surrounding tissues. Nearby tissue is inflamed and tender. Deeper veins not susceptible because of support of surrounding muscles. Anastomosis, union of two or more arteries supplying the same body region. Blockage of only one pathway has no effect. Circle of Willis underneath brain. Coronary circulation of heart. Alternate route of blood flow through an anastomosis is known as collateral circulation. Can occur in veins and venules as well. Alternate routes to a region can also be supplied by non-anastomosing vessels. Capillary exchange various factor affecting fluid at this level. Some factors cause filtration net movement out. Some cause reabsorption net movement back into vessels. Pressure-driven pressure differentials. Some things to know. Hydrostatic pressure, caused by pumping action of the heart. Oncotic pressure, pressure caused by blood proteins. Osmotic pressure, net movement of water across membrane based on concentration gradient. Starlings law of the capillary, as opposed to Starlings law of the heart. Basically, the net movement out at the arterial end equals the net movement in at the venous end equals equilibrium. Discuss the slight leftover fluid absorbed by the lymphatic system. Discuss the slight leftover fluid absorbed by the lymphatic system. 15% of filtrated fluid goes via lymph to circulatory system. Pathology for medics, since blood proteins are very important. E.G. Which ones? What happens when there are not enough blood proteins? What happens when the hydrostatic pressure arterially is very high? What happens if capillaries are extra leaky? Albumin, immunoglobulins, fibrinogen, fibrin, blood distribution. 60% of blood volume at rest is in systemic veins and venules. Function as blood reservoir. Veins of skin and abdominal organs. Blood is diverted from it in times of need. Increased muscular activity produces venoconstriction. Hemorrhage causes venoconstriction to help maintain blood pressure. 15% of blood volume in arteries and arterioles. Hemodynamics factors affecting circulation. Pressure differences that drive the blood flow. Velocity of blood flow. Volume of blood flow. Blood pressure. Resistance to flow. Venous return. An interplay of forces result in blood flow. Velocity of blood flow. Speed of blood flow in cm per second is inversely related to cross-sectional area. Blood flow is slower in the arterial branches. Flow in aorta is 40 cm per second while flow in capillaries is 1 cm per second. Slow rate in capillaries allows for exchange. Blood flow becomes faster when vessels merge to form veins. Circulation time is time it takes a drop of blood to travel from right atrium back to right atrium. Volume of blood flow. Cardiac output equals stroke volume 10 heart rate. Other factors that influence cardiac output. Blood pressure. Resistance due to friction between blood cells and blood vessel walls. Blood flows from areas of higher pressure to areas of lower pressure. Blood pressure. Pressure exerted by blood on walls of a vessel. Caused by contraction of the ventricles. Highest in aorta. 120 mm Hg during systole and 80 during diastole. If heart rate increases, cardiac output, BP rises. Pressure falls steadily in systemic circulation with distance from left ventricle. 35 mm Hg entering the capillaries. 0 mm Hg entering the right atrium. If decrease in blood volume is over 10%, BP drops. Water retention increases blood pressure. Resistance friction between blood and the walls of vessels. Average blood vessel radius. Smaller vessels offer more resistance to blood flow. Cause moment-to-moment fluctuations in pressure. Blood viscosity, thickness. Ratio of red blood cells to plasma volume. Increases in viscosity increase resistance. Dehydration or polycythemia. Total blood vessel length. The longer the vessel, the greater the resistance to flow. 200 miles of blood vessels for every pound of fat. Obesity causes high blood pressure. Systemic vascular resistance is the total of above. Arterioles control BP by changing diameter. Factors that increase blood pressure. Venous return. Volume of blood flowing back to the heart from the systemic veins. Depends on pressure difference from venules, 16 mm Hg, to right atrium, 0 mm Hg. Tricuspid valve leakage and buildup of blood on venous side of circulation. Skeletal muscle pump. Contraction of muscles and presence of valves. Respiratory pump. Decreased thoracic pressure and increased abdominal pressure during inhalation, moves blood into thoracic veins and the right atrium. Syncope. Fainting or a sudden, temporary loss of consciousness not due to trauma. Due to cerebral ischemia or lack of blood flow to the brain. Causes. Vasodepressor syncope equals sudden emotional stress. Situational syncope equals pressure stress of coughing, defecation, or urination. Drug-induced syncope equals antihypertensives, diuretics, vasodilators and tranquilizers. Orthostatic hypotension equals decrease in BP upon standing. Control of blood pressure and flow. Role of Cardiovascular Center. Help regulate heart rate and stroke volume. Specific neurons regulate blood vessel diameter. Input to the cardiovascular center. Higher brain centers such as cerebral cortex, limbic system and hypothalamus. Anticipation of competition. Increase in body temperature. Proprioceptors. Input during physical activity. Baroreceptors. Changes in pressure within blood vessels. Chemoreceptors. Monitor concentration of chemicals in the blood. Output from the cardiovascular center. Heart. Parasympathetic, vagus nerve. Decrease heart rate. Sympathetic, cardiac accelerator nerves. Cause increase or decrease in contractility and rate. Blood vessels. Sympathetic vasomotor nerves. Continual stimulation to arterioles in skin and abdominal viscera producing vasoconstriction, vasomotor tone. Increased stimulation produces constriction and increased BP, neural regulation of blood pressure. Baroreceptor reflexes. Carotid sinus reflex. Swellings in internal carotid artery wall. Glossopharyngeal nerve to cardiovascular center in medulla. Maintains normal BP in the brain. Aortic reflex. Receptors in wall of ascending aorta. Vagus nerve to cardiovascular center. Maintains general systemic BP. If feedback is decreased, CV center reduces parasympathetic and increases sympathetic stimulation of the heart. Carotid sinus massage and syncope. Stimulation, careful neck massage, over the carotid sinus to lower heart rate. Paroxysmal supraventricular tachycardia. Tachycardia originating from the atria. Anything that puts pressure on carotid sinus. Tight collar or hyperextension of the neck. May slow heart rate and cause carotid sinus syncope or fainting. Chemoreceptor reflexes. Carotid bodies and aortic bodies. Detect changes in blood levels of O2, CO2, and H+, hypoxia, hypercapnia or acidosis. Causes stimulation of cardiovascular center. Increases sympathetic stimulation to arterioles and veins. Vasoconstriction and increase in blood pressure. Also changes breathing rates as well. Hormonal regulation of blood pressure. Renin-angiotensin-aldosterone system. Decrease in BP or decreased blood flow to kidney. Release of renin results in formation angiotensin II. Systemic vasoconstriction. Causes release aldosterone, H2O and Na+ reabsorption. Epinephrine and norepinephrine. Increases heart rate and force of contraction. Causes vasoconstriction in skin and abdominal organs. Vasodilation in cardiac and skeletal muscle. ADH causes vasoconstriction. ANP, a trialnatriuretic peptide, lowers BP. Causes vasodilation and loss of salt and water in the urine. Local regulation of blood pressure. Local factors cause changes in each capillary bed. Autoregulation is ability to make these changes as needed by demand for O2 and vast air removal. Important for tissues that have major increases in activity, brain, cardiac and skeletal muscle. Local changes in response to physical changes. Warming and decrease in vascular stretching promotes vasodilation. Vasoactive substances released from cells alter vessel diameter, K+, H+, lactic acid, nitric oxide. Systemic vessels dilate in response to low levels of O2. Pulmonary vessels constrict in response to low levels of O2, shock and homeostasis. Shock is failure of cardiovascular system to deliver enough O2 and nutrients. Inadequate perfusion. Cells forced to switch to anaerobic respiration. Lactic acid builds up. Cells and tissues become damaged and die. Pulse points. Circulatory routes. Systemic circulation is left side heart to body and back to heart. Hepatic portal circulation is capillaries of GI tract to capillaries in liver. Pulmonary circulation is right side heart to lungs and back to heart. Fetal circulation is from fetal heart through umbilical cord to placenta and back. Arterial supply and venous drainage of liver. Pulmonary circulation carries deoxygenated blood from right ventricle to air sacs in the lungs and returns it to the left atria. Vessels include pulmonary trunk, arteries and veins. Differences from systemic circulation. Pulmonary A are larger, thinner with less elastic tissue. Resistance to is low and pulmonary blood pressure is reduced. Fetal circulation. Oxygen from placenta reaches heart via fetal veins in umbilical cord. Bypasses liver. Heart pumps oxygenated blood to capillaries in all fetal tissues including lungs. Umbilical A branch of iliac A to return blood to placenta.